Thank you, Stacy. And I would like to be able to identify a few people before I started this presentation. You've heard from previous speakers of the role of the legislature and the role of many citizens in what Iowa did over the last several years. I first want to start off with thanking Vice President Robillard, Chris Atchison, and Stacy Seifert for their leadership at the University of Iowa that allowed us as stakeholders and as legislators and policymakers to open up their resources here at the university. It was an incredible opportunity for us to have such a wide variety of professionals work with us over the past 4 years. I also want to acknowledge the state directors that are here, Charlie Krogmeyer, Susan Voss, Tom Newton, and the new director of the Agency of the Most Vulnerable, Ro Fagey, new director of aging. I would also like to acknowledge some of the members of the Legislative Healthcare Coverage Commission. David Carlisle spoke this morning. We have Mike Abbott, Tim Skiles, Joe Teeling, Betty Ahrens, Bruce Keppel. These ladies and gentlemen have been meeting for the past 2 years, and like our previous commissions, most of the work is being done at the sub-work and subcommittee work, so I want to acknowledge their commitment to healthcare reform. I also want to acknowledge 2 people who are here today who were from the original 2007 Healthcare Commission, Sharon Dryden and Julie Kuhl, who suffered 9 months of dozens of meetings throughout the state. And then, of course, my colleagues, friends in the legislature that are here, Senator Bob Dvorsky, Representative Doris Kelly, again, Representative Fagey, who was my co-chair of that commission, and our friend and former Senator Maggie Tinsman, and of course, Representative Uppmeyer and Representative Bowles. And last, of course, I want to thank the Legislative Service Agency staff that continues to work with us on trying to craft legislation. The presentation today is going to be straight from what I believe is the most important public discussion we have. And that really is the status of our healthcare system, our status of the healthcare reform, now the health law of the land, and what's being said, and how good is this for Iowa. We have embraced healthcare reform. We have the healthiest children, as Kate had said earlier. We have one of the lowest uninsured populations of the state. All the stakeholders were involved. There was a wonderful article in the Christian Science Monitor about how Iowa and state legislators were able to reach across to the other party and all the stakeholders to come up with significant reforms, some of them clearly before the federal legislation. And of course, because of that work of all of us, we have created a national model. Healthcare reform has benefited, and what are the benefits for Iowans? Prevention, certainly the work that we do with medical homes going through the community health centers will provide an incredible test of our ability to move people from a sick care system to a health care system. Children's health insurance, with the help of many children's advocates, Carrie Fitzgerald and the Children's Policy Council, we've identified extraordinary opportunities that gave us extraordinary strategies to follow to make Iowa the state that the legislature proclaimed 2 years ago, that by the end of this year, every child that's eligible for Medicaid and Hawkeye will be enrolled in those programs, making us the highest state in the union of insured children in the country. Stem cell research, protecting and improving Medicaid, Medicare, eliminating health disparities, choice of family planning, mental health and substance abuse services, HIV, hepatitis C, and other services that clearly provide services to the state. What people have talked about, and I want to spend a little time on this chart. This is a chart that was created by the Kaiser Foundation. And in a poll of Americans across this country, they asked people, what did you feel about component parts of the health care reform bill? And what was amazing, and what you don't hear, is that if you take the component parts of this bill, and we've listed them on the left side, you will see an overwhelming, wildly overwhelming support. Health insurance exchanges, 87% of Americans support that. 94% Democratic, 88% Independent, 77% Republican. You go down the list. Tax credits to small businesses, 82%. Help care for Medicare, help to close the Medicare donut hole, 81%. High-risk pool for individuals with pre-existing conditions, 78%. Subsidy to assist individuals, 76%. Extending dependent care to age 26, 71%. Medicaid expansion, 69%. These are numbers that if they were our polls for us in our re-election, we would be ecstatic. And you go down the line, we are ecstatic, and Americans like the component parts of this bill. In another slide that I won't, another part of the poll that I won't show you, was that what Americans are realizing is that they didn't know that these were part of the health care reform bill. On the first one, I'll give you an example of the health insurance exchange. 87% of the people think that's a good idea. Only 61% knew that it was in the health care reform bill. And that number is shifting. The more people know about what's in the bill, they like it. In this case, the parts are more popular than the sum. And as policymakers, we have to understand that so we don't react to false impressions of pollsters, of political advisors, of talking heads, of maybe people in our own party that's saying that Americans are not a fan of this bill. Americans love the component parts of this bill, and this is the heart and soul of what's in this bill. These aren't the peripheral issues. Now, I'd like to know what so what I like to be able to do is take what I think the Republicans are saying on the campaign trail and provide an opportunity for this to be discussed. Governor Branstad promises repeal. In politics.com, it's reported that Republican gubernatorial candidate Terry Branstad is against the historic legislation to repeal or to reform health care that will help seniors, families, children, small businesses, and young Iowans. Now candidate Branstad opposes. It's putting him now his opposition is putting him at odds with many of his own party. And Representative Bowles today said that he would join the lawsuit that 20 other states have proposed to repeal the individual mandate and go to the heart of this reform effort. But he's not alone. State Republicans, they also promise repeal. That's reported in IowaRadio.com. Former New York Governor George Pataki is in Des Moines today for a RevereAmerica.com event. The group is seeking 1 million signatures on a petition which calls for repeal of the National Health Care Reform Plan President Obama signed into law this spring. Very clear. At that press conference, it's reported that Republican Party of Iowa Chair Matt Strom opens by recognizing elected officials in the room. State Auditor David Vaught, Senator Larry Noble, Senator Kim Reynolds, Senator Brad Zahn, Representative Eric Helen, Representative Renee Schulte, Representative Linda Upmeyer, and Representative Rod Roberts. Those in bold letters are members running for statewide or congressional or leadership positions. Now, our Republicans want to repeal health care, but what does that mean for Iowa? And let's talk about exactly what they're talking about. Not the peripheral issues on the side, not the political spin that fans don't like it, that we have some problems with some of the issues, but not all of it. It means that if they are successful, either in their lawsuit or stopping the appropriations for legislation, it means a continued denial of coverage for pre-existing conditions for children, which right now they are covered. No new small tax breaks for small businesses. Losing your health insurance if you get a catastrophic illness. No tax breaks to help purchase insurance. The Medicare prescription donut hole will continue and grow. No health insurance for the uninsured, including 300,000 Iowans. Children up to 26 can't stay on their parents' insurance. No consumer-friendly health insurance marketplace, and no healthcare system based on preventive and wellness. That's what this means. This passion that we have to have for this issue is not something that's academic. This passion means lives, it means health, it means quality of life. And your political people are now debating it. And it's up to us to go forth and make our declaration this November. Repeal would mean turning the clock back on health care reforms in this state and all over the nation. Repeal would mean losing the economic advantages health care reforms has given to Iowa, and especially the 56,000 small businesses that right now, today, can get tax breaks for their participation in buying a marketplace insurance policy. And repeal would mean disaster for Iowa families. This is not just a simple academic exercise, ladies and gentlemen. This is the heart and soul and a fight for the truth of what this bill is going to do for our families. I'm not up here protecting doctors. I don't believe for a moment that doctors are going to bolt out of one state, go to another, that they would disappear like one of our speakers said during lunch. I'm not going to tell you, and I don't even think it's fair to talk about how hospitals are going to close. That's not going to happen. What this really means is doors will be closed for patients that need help. That this attitude that previous speakers talked about, how we have to shift on how we look at health care, the personal responsibilities that this law is requiring of every American. This is not a giveaway. And then most importantly, it means how we as Americans look at the moral imperative of our own system of justice. This is not academic. This is real. Thank you.